So welcome everybody to this very important webinar on the role of the private sector and the public sector in the COVID response in Africa. Today we are very lucky to have with us two highly experienced public health professionals who know the African context well. We have with us Dr. Moeti, the Regional Director for WHO for Africa. Dr. Moeti is a public health veteran with more than 35 years of national and international experience in the African region, and is the first woman to be elected as the WHO Regional Director for Africa. So welcome, Dr. Moeti. We're also lucky to have with us today Amit Thakker, who is the chair of the African Healthcare Federation. Amit, again, has a long history of healthcare experience in Africa and has been a key player in the Federation and its sister federations. The African Healthcare Federation brings together private sector stakeholders under one umbrella body to advocate for policy change and to work on the interests of the private healthcare sector in the African region. My name is David Clarke. I work at WHO HQ in Geneva. I work and lead on private sector engagement, supporting countries with their UHC objectives and better using the private sector as the means to achieve those objectives. So once again, welcome to everybody. Just over to Dr. Moeti and to Dr. Thakker to make some opening comments.
Dr. Moeti would like to go first?
Yes, thank you. Is this where we use the PowerPoint presentation?
David, do you want them just to do a few hellos before?
Great. All right.
Sorry.
So, yes, thank you very much, David. So hello to everybody. It's a great pleasure for me to join you this afternoon for this webinar. And I'd like to thank Amit very much for being such a fabulous partner, him and the Africa Healthcare Federation, and for giving us this opportunity to share with you our thinking, what we know about what's going on in African countries in general, and really explore together how to facilitate, strengthen, expand the partnership between the governments and the private sector in the African region for the interest of African people's health. So I very much look forward to our discussion this afternoon, to learning from you what you think you can contribute, and then we have the role of then linking that up with the government. So thank you so much, and it'll be a great pleasure for me and my colleagues to be with you this afternoon.
Thank you. Thank you, Dr. Moeti. This is Dr. Amit Thakker. I think the last 3 or 4 years has seen a major shift on the way private sector and WHO is working, thanks to leadership that is in WHO, and also to Dr. Moeti and her team, especially WHO Afro. We have seen a tremendous shift in the way we work together in private sector and WHO. And I also want to give a big shout out to Dr. Tedros, who was already involved in many of the EAC initiatives we had with the private sector on the corridor activities before he took on the WHO leadership role. So it's really amazing how we have moved in this journey, and this webinar is yet one example, just showcasing that working together, we will make a huge difference. I want to also thank many of the federation leaders who I already see have logged in from, at least I noticed, 7 or 8 countries right now. And many of these are champions who run large private federations in their own countries. So I'm really looking forward to this, and thank you, David, for taking this lead.
Thanks both. I think we're now going to kick off with some introductory comments. We have some slides which we're going to share. Can we have the slides now? So my role in this is just to give some introductory comments to give a global perspective on this. So obviously the whole COVID situation is pretty unprecedented pressures on health systems. And so at WHO HQ, we've been working with our regional office colleagues and our country office colleagues to help them to mobilize the private sector COVID-19 response. Next slide, please. All of this work from at the headquarters level comes from work that we've been doing at HQ for a little while now on how we can work better with the private sector for UHC. We have had an expert advisory group on the governance of the private sector. We've been working for 2 years on a new roadmap, which is intended to provide a new way of doing business for health systems governance for the private sector, and with a vision of ensuring that we have well-governed health systems in which the public and private sectors can collectively deliver on the realization of UHC. Next slide. But with the COVID situation, we have shifted the emphasis of our work because we realized that the COVID pandemic has triggered a global surge in demand for health services. And in response, all countries are striving to urgently increase their capacity in their health system to test, trace, and treat COVID patients, while also maintain essential health services. Next slide, please. And the sorts of things that the governments are looking for, and this is a global picture. This is what we're finding from talking to all our member state governments. They're all looking to us to strengthen established essential public health measures to stop the spread of the epidemic, including information, communication, surveillance, testing, and contact identification. Obviously facilitating treatment for those with COVID-19, managing stocks of essential materials, test kits, ventilators, and oxygen, and ensuring that all health workers, importantly, have access to the tools to protect them while they're doing their jobs, including access to personal protection equipment. And critically, and most important, protecting the most vulnerable people in all of our communities from this terrible disease. Next slide, please. So why is WHO working with the private sector in this regard? Well, in this regard, I can only quote the Director General of WHO, Dr. Tedros. He said that governments must adopt a whole of government, whole of society approach to COVID-19, mobilizing all available resources to keep health systems functioning. We think that drawing on private sector resources and capacity is critical because in almost all countries, and especially low and middle income countries, the private health sector provides a significant proportion of essential health services and products to the population. And in the global context of the COVID-19 pandemic, the pandemic is simply overwhelming many health systems, and turning to the private sector for additional capacity has become an important part of the campaign to save lives. Next slide, please. And we already have seen from a number of countries who are further ahead in the pandemic what a difference it can make to mobilize the private sector. We've seen a number of countries effectively mobilize their private sector as part of their response, particularly the European countries where you see England, France, and Germany, and Italy as a few examples, who added thousands of beds, thousands of health workers, and much equipment to the response to boost their overall ability to deal with this terrible epidemic. Next slide, please. However, at WHO, we have been doing some work on this to look at what the challenges are for other countries. We've recently published a document which is based on interviews with key stakeholders in a number of different WHO regions, which demonstrates that there are 6 key policy challenges, which we'll touch on today as part of the conversation, which will impede the ability of mobilizing the private sector as part of the COVID response. So the first one is that in many countries, the private health sector isn't involved in national health policy and planning processes. Governments are often unaware of what private sector capacity and resources there are in specific countries. In some countries, governments are struggling to know how to engage with the private sector. In other countries, the private sector lack the required inputs to play a meaningful role. So for example, they might not have access to clinical guidelines or consumables or personal protective equipment. In some countries, there is no or limited plans to help to finance the private sector role. And private health businesses are experiencing significant difficulties in the economic crisis caused by COVID, like many other small businesses. Next slide, please. So our response at WHO HQ to backstop for our regional offices and our country offices is to work to help countries to plan to address these challenges and to work with the private sector as part of the COVID response. So we have published an action plan for ministries of health, organized around 6 pillars. One, to get organized to work together as part of countries' planning processes, to involve the private sector in those and to organize to work together. To focus on space, to secure private sector assets and resources to increase surge capacity. To look at staff, to mobilize and rationalize public and private health staff assignment according to needs. To focus on the stuff that people need in the health system, to ensure that all health facility staff have the supplies they need to respond to the crisis. To focus on systems, to establish systems to better integrate the public and private sector response efforts. And last and critically, to look at the financing aspects, to secure financial mechanisms to ensure access. That's the end of my presentation. So I was just asked to give a global picture of what's happening, but I would like to turn over now to Dr. Moeti and Dr. Thakker to give their presentations on the specific issues that are affecting African countries. Thank you.
Right, thank you very much. Thanks, David, for that overview. It's kind of framing some of the principles and suggestions and ideas as to how to take this forward. So we thought we could, from the African region perspective, share with the participants of this webinar some of what's been happening in the African region, not only in relation to the COVID-19 response, but more broadly, as far as the engagement of the government with the private sector. Some of the progress that has been made, some examples, and how then it can inform the opportunities that arise now, since governments have to quickly access all the capacities, partnerships that they can in responding in this very difficult situation. And we hope at the same time then further the relations, the partnership between governments and the private sector, so that going into the future, some of the beginnings that have been made can be built upon. I mean, we've seen in some of the most difficult situations, for example, the Ebola outbreaks in West Africa, that some of what gets done then does get sustained into the future and changes the way of working. So I'm very much hoping that if there is an uptake by governments, if there's a recognition of the tremendous capacity of the private sector to help, that can support the situation now in this very urgent phase, but also contribute to improve partnership going into. Next slide, please. So what I'm going to talk about, I'll just touch briefly on the work that we've been doing in WHO to promote and support public-private partnerships in the region, what progress has been made in this between governments and the private sector in the region, some of the challenges that countries are confronting as they respond to the pandemic, and highlight some opportunities and indicate what we are suggesting could be done by both governments and the private sector. Next slide. I'm sure this is very obvious to you, but, and I think David's already said it, our countries have committed to universal health coverage, to make sure that everyone has access to healthcare, to make sure, very importantly in today's context, that people are protected from threats, including disease outbreaks and other public health emergencies, and with an emphasis on leaving no one behind, equitably ensuring that everyone is taken care of, protected from outbreaks and infectious diseases, as well as has access to essential services. We very much share the principles, have promoted these principles, because we think that that's the most efficient way in which governments are going to be able to reach their goals for improving the health of their populations through equity. Affordability is of course important in our region because of the resource challenges that all of our countries are facing, and with an emphasis on fairness. We know countries have been working on this for some time, and it is really a big challenge both to provide the services, deliver the services, but also ensure that people can make an effective demand for these services and overcome certain barriers, cost, distance, where people are living, etc. So those are some of the aspects that we emphasize. And just recognizing and emphasizing that the private sector has a very important role to play as a partner to governments with the resources, the experiences that we have. And we recognize, of course, that there is a need to acknowledge the need to have a return on investments that people are making when they start a business, but also emphasizing the need to balance that against equity and affordability and really working together with governments. Next. We've talked about this. I'm just showing you a picture of Africa Health Forum that we held last year in Praia, in Cape Verde, in which we had a very interesting session on the partnership between the private sector and public sector. Amit, I think you were at that meeting and in the panel, but perhaps I'm mistaken.
No, I was. It was a very useful one. And I think,
right. Okay, I mean, just to highlight that in WHO, in the African region, we are very committed to this because we recognize that the huge capacity of the private sector, the opportunity that it represents to our governments as they work under very challenging circumstances to provide healthcare and prevent disease among their populations. So what came out of this, this session was a strong call from the private sector partners who were there for the governments to be able to regulate what happened. And then also there was a very strong agreement on the need to continue to work on the relationships, to improve the relationships. I remember the word trust being used a lot in that session. We need to find ways to get to know each other well enough to build that trust so that there can be openness and transparency in communicating in order not to miss out on the opportunities that, that exist. And a call as well to have a combination of benefiting from the international private sector, but also investing in growing the national indigenous private sector so that local companies of whatever size can be involved in various activities that can contribute from the private sector, including in the production and manufacturing of medicines and vaccines. And I have to say, what's happening at the global level today has made that a really urgent business. We've been involved, I will say in a minute, in discussions with NEPAD and some of the private sector in the region in some meetings that are being held to really look at how to benefit from, leverage the existing capacity and invest in developing the capacity for manufacturing locally. And then thirdly, that governments should put in place preferential purchasing policies so that they can stimulate the growth of the pharmaceutical sector in the region. Next, please. So what has WHO been doing? Well, the way in which we work with countries generally is to help them make choices, analyze their situations, develop their policies, and then develop, if you like, their strategies and frameworks to guide how they're going to take action. And here, as far as this is concerned, we have helped to draft some of the tools that will enable governments to engage effectively with the private sector, including compacts which guide how each going to work with the other, how they are going to act and behave, some principles of how these partnerships will be run. And in some countries, we've helped them to actually outline, if you like, in some detail, a memorandum of understanding, which set out how this joint work is going to happen. So we have a number of countries where some of these have already been developed. So this is the basis for engaging, where the rules are clear, everyone understands their role, understands how to work together, which we hope are going to facilitate this partnership. We have a regional so-called Harmonization for Health in Africa platform with UN agencies, with the African Development Bank, and with some of the bilateral agencies that are very much involved in supporting governments in Africa. And we decided that one of the priorities on which to work together, and this work for the moment is led by the African Development Bank, is to build a body of evidence, look for the information and understand ourselves. We were very keen in WHO to get to know better what it is that the private sector is doing, has the potential to do, is intending to do to support health development in Africa, and also then to be able to provide this to the governments and use this in our own work as we advise governments, and also use it to facilitate that growing of the partnership and mutual understanding between governments and the private sector. I've already said as far as COVID-19 is concerned, there have been a series of discussions led by the AU's development agency, NEPAD, which is based in South Africa, and UNIDO, on how to very quickly engage the private sector in Africa, particularly, I think, with a strong emphasis on the production of some of the items that are very important in the COVID-19 response, where at the global level there's been market distortion and tremendous difficulties for African countries to have the access that they need. Next, please. So what we see as the private sector contribution in Africa, if you look on the right side of the slide, we recognize the private sector contributes in different ways, including providing healthcare, helping to develop infrastructure, and either your own infrastructure or engaging with governments to help them to expand their infrastructure, which I might add is still a huge gap in most African countries. Of course, the procurement and logistics capacity of the private sector is extremely important in our region. There is also the training that can be carried out, so the skills transfer, engaging the private sector as well. I've talked about manufacturing already, and then providing support services which are essential to the provision of healthcare, and very much innovation, new tools, new ways of working that will help the governments to improve their efficiency, their effectiveness, the scale of what they're doing, help them to cover some of the gaps between what's possible to do in a faraway rural place in an African country and accessing some of the skills that may be available in the capital city, for example. And even management, I didn't mention management, but we have a very good example of one country that had, like many of our countries, had a very inefficient hospital system and engaged a private management company which really turned around the efficiency of several of its big hospitals. And on the left, we can see that the private sector provides a significant proportion of healthcare in the region. And the slide, this graph just shows that people across all the wealth quintiles, so both low-income households and some of the more wealthy people, use the private sector. So the private sector has a role not only in helping those who are better off to access wonderful care, but also contributes to providing healthcare for low-income households. And this, I think, is something that can also very much be leveraged because that's where governments are struggling to ensure access to people of these socioeconomic groups. Next slide, please. Okay, I'll just skip over this because I've mentioned some of this. It's some of the ways in which partnerships are being established in countries. I'll say something about the sector-wide approaches, which have been put in place in a number of countries, meaning the government decides they are going to manage or quite often reform the health sector in certain ways. There is a very strong emphasis on engaging on an inclusive process of engaging all the contributors, all the stakeholders, and this provides an opportunity for policy dialogue that could involve the private sector as well. So it needs the government to recognize the private sector as an important contributor to health, and in these mechanisms, fora that are established for dialogue, for planning together, for monitoring and evaluating together how the health system is performing, the private sector can have its place. And this is where the opportunity can arise them to work in more detail on how the private sector can contribute. So I just wanted to emphasize this because it's a huge opportunity for the private sector to be at the policy table and to be able to advise the government of what you can offer, and also then to agree with the government. So that can lead then to the compacts, to some of the partnerships on mechanisms for supplementing the private health capacity so that you contribute, and making sure then that some of the cost-related issues are addressed there. I've been the representative in Malawi where this was very well developed by the government quite a few years ago. And then the others are some of the mechanisms. Vouchers can be used to ensure that part of the government's ambition to provide healthcare for everyone, the private sector plays its role, and there is a way of ensuring that people have access to private health services. And then, of course, we very much value and recognize the organizations like the healthcare foundations as partners to reflect with together, with whom to work together, so that we support this collaboration between governments and the private sector. Both, and of course, we know we work also very much with the faith-based groupings who provide a significant proportion of health services in African countries as a way of working around a group and being efficient in how we organize the dialogue and the working together. Next slide, please. So some of the feedback and our own reflection of what governments can do to better benefit from the capacity of the private sector and to contribute to strengthening this collaboration and partnership. First of all, I think it really does need strong political leadership at the very top, because at the end, it's around policies, building trust, building enabling environments in terms of legislation, regulation by governments, and really giving the signal that these partnerships are valued and encouraged and will be supported. And we've seen where the heads of state have engaged directly that this really is a big help. Again, we've understood that the regulatory systems really need to be well developed so that they provide this environment which is facilitatory. The private sector is investing, so the better the investment climate that the government is able to provide the right policies, the more they'll be able to benefit from these partnerships. And then people need to be guided clearly so that navigating the process of setting up, working is facilitated. And in addition, we encourage not only seeing how to work with the private sector that exists or that knocks on government's door, but making it conducive, making it attractive. Because I think governments have realized that the capacity that they are able to grow, expand with whatever level of investment, it'll take quite a few years before they're able to provide all that needs to be done, not only to deliver healthcare, but there are some areas that are perhaps better carried out by the private sector. And if it's in an effective partnership with the government, then the governments can leave that work to the private sector. And my colleagues have proposed that, there need to be some incentives if the government are really driving some of the equity principles and want to make that work. So if we are going to encourage the private sector to invest in areas that may not be so attractive in terms of size of market and operations, then perhaps some incentives could help in the way of financing, in the same way as they do very often have to do in order to give incentives for healthcare workers to accept to work in some of the more challenging contexts. And then, of course, on the other side, they also need to be able to monitor, regulate, ensure that their standards for whatever it may be, provision of healthcare, the quality of the products that are both produced or imported and marketed by the private sector are adhered to. There's always a drive towards affordability. So making sure that they act to enable business to happen, but in a way that can be affordable for people, and overall to have mutual accountability. What is it that the government is going to do and be accountable for, and also the private sector partners. So everybody is accountable to the principles, the agreements, and really to the vision and goals of this government in providing healthcare to its population. Next. So coming to the COVID-19 response, and I think some of this has already been outlined by David, just a few examples. Yesterday, I mean, just not to take too much time, but I held a meeting yesterday with all the African health ministers. We are preparing for a World Health Assembly virtual meeting next week. And we provided a briefing on the COVID-19, and they were able to relate what they're doing and very much relate the challenges that they are facing. And I would say what we are proposing here as a partnership with the private sector would really address some of their biggest worries at the moment. So governments are working, as David already said, to be able to provide treatment, to be able to carry out testing, not only in the capital cities, but we're encouraging them very strongly to get out into the hinterland, as we've seen in a number of countries, geographic spread of the COVID-19 response. So it's no longer feasible that they will set up a treatment unit only in the capital city. So there's need to develop or renovate and repurpose infrastructure relatively quickly all over the countries. In the same way, there's need for them to be able to carry out lab testing, not just in the capital cities with all those challenges. So we think that you could be partners in these areas. Infrastructure, in treatment, very much the private sector in some countries has a capacity to partner the government and take on the treatment. We're just giving the example of South Africa, where given the way that the virus entered the country, many of the people who were initially identified as cases actually were done through the private hospitals. And other countries too do have this capacity. Local production, I've already mentioned, but it was absolutely the #1 challenge that the ministers talked about repeatedly. So personal protective equipment, ventilators, sanitizers, and I'm really happy to see that we are seeing this happening in some countries, supporting distribution of the supplies that they're bringing in. Contribution of supplies too, where it's possible. We've seen governments mobilize from the private sector, from philanthropy towards their response plans, resourcing in some of the countries. I'm sure you are aware that the African Union and the Africa CDC, working with their bureau, chaired by President Ramaphosa of South Africa, is mobilizing strongly private sector leaders in Africa to contribute, and is also has set up a fund to which the private sector is contributing, as well as some governments. And just to give the example, I'm sure Amit is going to talk about the National Business Compact on COVID-19 in Kenya. So I won't enlarge on that. Next, please. Okay, the challenges. I've already talked about the supplies. That is okay. I won't relate some of the anecdotes around supplies where really it's a shared problem between WHO, because we're being asked first and foremost to help the governments to have access to some of these materials, and have worked with partners to set up a global procurement platform, which is now out on the market seeking some key supplies. Another challenge related directly to this is that in most African countries, the rate of testing is quite low compared to what's happening elsewhere in the world, certainly in Asian countries and in Europe. And what we've noticed is that some of the countries, middle-income countries that have some of their money have gone out into the market and found ways of accessing these services. So it needs to be much more efficient, we think. If really African countries are going to have to be competitive on the global market, while we are pleading for global solidarity and for those who have production capacity to ramp it up, if we can do with some of our partners, some of that market shaping, defining the quantities that are needed, as has been done for other items. We know that Gavi has done a very good job of that, the Global Fund to some extent. So there's some experience in the multilateral organizations, developing new technologies. I think I don't need to talk about this. If you switch on CNN, you'll hear every day the discussion about the vaccines, the therapeutics, the test kits. So this capacity, and we've seen the willingness of the private sector to engage in this. It's proving to be challenging at the moment because of the urgency of the pace, related to the pace at which this is, the pandemic is evolving, and the immediate needs of many countries to work on things. And then really urging continuing investment in research and development for developing new tools, while very carefully from the African perspective, looking at the need to have equitable access, including for low-income countries, and in those countries, low-income people. So we think that the private sector could come with some ideas as to how to help to address these challenges, and I'd be very interested in hearing those from you. Next slide, please. Okay, I think I'll skip this over in the interest of time. So I've already talked about being more business friendly as far as countries are concerned. We have a growing political movement around the continental free trade area, where more and more countries are ratifying this. So hopefully then it'll make cross-border business investing in the African region easier. Next. So as WHO, based on what we have observed, what we are doing, working with countries, as I said, we think that this could be an opportunity to further build the strength of these partnerships in many ways, for health in general, for universal health coverage, which for us is at the top of our priorities, because it encompasses also emergency preparedness and response. And as far as we didn't talk a lot about this, David did mention that while there is this response to the COVID-19, it's very important to continue to provide other health services. And I'm certain there are opportunities here for private health providers to avail their capacity to governments, so that what governments can do, which is very challenging to address those two imperatives, is supported. And then strengthening regional approaches to yield better results. So working across countries, we already have organizations like the regional economic communities trying to leverage their relationship with countries in order also to achieve economies of scale in procurement. I have to say we've had discussions over quite a few years at the level of SADC and other economic communities on some of this. We've learned a lot about what it is that impedes this working, and we think the opportunities are here now. Then from the perspective of governments, as I said, just for them to create an enabling environment so that the legislation is there, the policies are there, and that in a way the space is created, it works more and more effectively, the dialogue is there, the rules are well defined, and everybody knows how they have to act. Thank you very much. That's why I'll stop. Apologies for it being a bit long, and I hope we have enough time for an interesting discussion after Amit has shared his perspective.
Thank you, Dr. Moeti. That was really insightful. I do want to thank all the country leads that I've already seen who are with us: Ethiopia, Zambia, Uganda, Nigeria, Egypt, Liberia, Cameroon, Ivory Coast, Togo, Senegal, Tanzania, Kenya, Ghana, at least the ones that I've seen who've logged in. Our colleagues from USA, Japan, Germany, and France are other countries that have logged in from outside. So let's move on to the next slide. I'm really keen to jump into what David and Dr. Moeti have talked about, and I'll tell you a little bit about the Africa Healthcare Federation. And a lot of what's been covered will be some of the offerings that I'll mention from private sector, but we will then eventually go into challenges that we are facing and show you some case examples on how private sector has been responding in different countries. Next. So as you know, the Africa Healthcare Federation, that is now just 3-4 years old, but we are 15 years old in terms of how the private sector has been organized in different countries. We created very quickly, once there was the first few cases in Africa, the Africa COVID-19 strike team, many of the members who've logged in and supporting us. And obviously, when we talk about the private sector, the first commercial private sector in different parts of Africa came together to organize themselves. And we've been helping to bring all the rest of the private sector together, including faith-based organizations, NGOs, formal and informal. So over the last 2 years, our growth has been pretty phenomenal. And we've encompassed all these providers that you see and institutions that you see in this slide. Next. Can we move to the next slide? Africa Healthcare Federation's Pan-African role is centered around the 5 regions, as you see here. And our presence has grown, especially in East and West. Those were the 2 leading sections of the continent that we saw drive and great investments and probably also great inter-border relations. And it became stronger because of the Free Trade Continental Agreement. ECOWAS, the EAC has been very strong. We've recently also started engaging Southern African countries, and they've come up the curve pretty well with South Africa, Namibia, Botswana, to name a few countries. So over 30 countries, we have some sort of a link that we can reach out to businesses that are involved directly and indirectly into the healthcare sector. Next. Similar to what David presented earlier, and in the 6 pillars that David put through, we can give our strengths from the private sector on the same 6 areas. And our COVID-19 action plan, going clockwise from number 1 to 6, is as follows. So we do want to partner with the government, and some countries are doing it well. The others need to do it better, both from the public and the private side. And this is where Dr. Moeti, we will team up with WHO with your link people from WHO Afro who are on Anglophone and Francophone links, so we can tell you where we're doing a good job, where we might need your help, so as to break into the ministries of health to get ourselves on the table, on the discussion room when it comes to COVID-19 response. Obviously, in our own countries, in some of the countries, we have to get better organized in bringing the private sector together. We talked about marshalling space. I'll give you some examples, like Nigeria, and amazing work they've done with army huts, field hospitals, great work being done with containers in Kenya, amazing work being done in South Africa on mobile clinics, and how we've repurposed schools and other infrastructure. The architects have come on board as well to help hospitals become safe zones so we don't have cross infections. And that's another thing that private sector has done in the second. And the third one is organizing and assigning the private health sector staff according to need. Now, we do employ a substantial amount of staff in Africa. In the pharma sector, it's over 72% when it comes to pharmacists and supply chain, that Africa private sector is a large employer. So at this point, when we need lab technicians, we need community health workers and doctors, we should be able to work around activating our staff to help. Ensuring supplies, you both have touched on what a strong role we play in the supply chain system. And of necessity here is to ensure that we don't let unscrupulous players seep into the market and take our dollars into and creating waste. So the Federation provides some kind of an self-regulatory forum, and we can ensure that the spend is effective, we're getting the right price at the right time from the right vendors. And that's a critical saving. If the ministries just impose that, I think we will probably get 20 to 30% more care. Then the fifth one is establish systems to integrate both public and private sector response systems efforts. And this is where I think we can have referrals like in Rwanda, and I'll give an example of that. And finally, Dr. Moeti, you mentioned a lot about securing funds. There's a lot of work being done by AfroChamps, as you mentioned. You know the special envoys, the 4 envoys which were appointed by Cyril Ramaphosa, and you've seen the amount of money that the private sector have been bringing in, not only in cash, but also in kind to support their countries. But I must mention that the ICT and mobile health is going to be one key game changer in the amount of deaths that we're able to prevent in Africa. And it's a cross-cutting, it's a cross-cutting matter that I think could do really well in all the countries, and private sector is leading. Next. So we have acted on all these 6 pillars that David did mention. To just give a few examples, and the Healthcare Federation of Nigeria has presented a value proposition to Lagos State. In the Kenya Healthcare Federation, we are fully part and parcel of the task force with the Ministry of Health, attending regular calls, regular meetings, and we update each other. And that's built over time, and you talked about trust. Lagos State is contracting private labs to conduct testing. That's bravo, really good. They worked out the business model and even the financial model. Private labs in South Africa have joined public labs for COVID. It's very interesting to see how they have put up the PCR machines onto mobile vans, about 73 of them, and going out. No wonder they've recorded the highest tests in Africa. In Kenya, Aga Khan University spent about $5 million to put up an isolation unit just to ensure they have a separate, complete triage system that patients can be helped. Nigeria, private sector raised $1.5 million and gave another $1 million for working capital in an isolation, just a simple field hospital. In Rwanda, the private sector is fully integrated. When I was speaking to Dr. Jean of Southern Cross Hospital, he says, I received packs of masks and I got overalls and PPEs as private sector, because Rwanda then spent its GDP and money thinking that private and public is one single health system, because citizens and the virus does not differentiate between public and private. So when they are catering for safety of the citizens, When they look at the $10, they are giving it to both public and private. So the private then don't charge for it. That's the most important. So we give you something to protect a health worker, whether you work in public or private, because you're still Rwandan, but you must then not charge the patients for it. Next. In Uganda, I think you can see how the factory have started improving supplies like CIPLA in COVID therapeutics. Several countries, Dr. Moeti, like you mentioned, have repurposed their machines, some that were rusty, some were lying idle, to start producing face shields and PPE. It's pretty impressive what we have seen. Very impressive is also what Senegal is doing on trying to bring in this $1 test. As soon as the trials are over, we will look forward to that test, and if it's effective, we can then sell it to the rest of the world. And we don't have to always wait for something to come from outside to Africa, but Africa can also sell to the outside global population in saving their lives. Innovation in manufacturing oxygen and respiratory apparatus domestically, as you realized, and we all realized, that the global supply chain got interrupted. As soon as the flights from China stopped, and this movement stopped, many of our traders who relied heavily on goods and raw material from China needed to think again. We realized when Europe was also affected with the supply chain, we had to think of how do we get material and start printing locally, whether it's 3D, whether we repurpose mechanical equipment like Toyota Kenya has done, or Kenyatta University has done here. What should we do to identify where oxygen is and which cylinders are idle, using SMS technology to see the level of oxygen per tank and returning the tank back for refilling. So great innovation. I think Africa will become much stronger after the surge of this COVID disease, especially when it comes to innovation. If you look at systems, the amount of patients that are currently going on teleconsultation is incredible. We've got Wheels for Life that's been introduced by private sector, giving mothers free rides using Uber or Bolt in many countries, especially during lockdown and curfew hours, because we don't want to have any maternal mortality. In a country like Kenya, we've already done about 134 free rides, and we have another 1,000 rides that are given by these private sector providers. So that's through a call center. But many patients are also using telehealth and telemedicine to get their outpatient and treatment being sorted out. You've seen the e-commerce has shot up, and the e-commerce on telepharmacy is proving to be really good. A company like MyDawa has got this app that brings drugs to your home, so you literally don't need to move out. And obviously we need to start using telelab, and maybe those who have apps will be telling us if they are symptomatic. We shall be dispatching a motorbike to go and take the oropharyngeal swabs and maybe do testing, and that mobile testing might be good. Use of drones in Ghana to take samples is another exciting. So those are helping in building systems. There are organizations like YPO that have set up a field hospital in Lagos. That's money coming in from the businesses. Large telecom sectors such as Safaricom put in $2 million into a kitty called COVID Fund. Private sector task force raises $25 million in kind in the same COVID fund in Kenya that I've mentioned, helping, like Dr. Moeti said, the National Business Compact, which have also brought in huge amounts of sanitizing stations across many hotspot zones so as to keep as many people safe. These are just a few examples that I wanted to share around the 6 pillars that David spoke about. Next. If you look at some of the challenges, I think engagement with MOH, if the MOH are reluctant to include private sector on planning purposes, that is the beginning of failure. And I think the message to the ministers of health, Dr. Moeti, would be that if you are able to engage private sector, there's a lot to gain and not a lot to lose. And so among the 54 countries, I would say at least there are 15 or 16 that need to be informed about engagement rules. And the data is the second challenge. MOH like critical data on private sector. I do agree that that is again a trust between the two. Back. Sorry. Yeah. And then the inputs, private sector lack key inputs on information, guidelines. And this is where I think our relationship with ministry works, and also with WHO. It would be really good to get this information on a regular basis if we get a focal point from WHO Afro. The shutdown isn't helping private sector. As we all know, it's reduced the patient demand and footfall. So some of the smaller hospitals are going to unfortunately close down, like we've seen in US as well. And without economic stimulus, they'll be out of jobs. Provider payment, MOH reluctant to contract for private health services. Most services are still under the Ministry of Health docket, including maybe testing, treatment, maybe mortuary services. It might be useful to start thinking about outsourcing some services that the government has no capacity or are overwhelmed. Then industry support. Private health sector businesses are exposed to significant financial losses, and we need to really find a way to keep these active, youthful, gainful employment citizens in their job. Next. So the opportunities for COVID-19 can be a game changer. I think this will build our partnership much, much stronger than where we are. Our relationships with development partners and governments is going to be even stronger. And I can see many of the leaders who've logged in are going to work on this. It'll make our private sector more unified amongst ourselves so we can speak with one voice. The solutions is to look for Africa, within Africa, to find African solutions for the African problem. And this is where I think inward looking to make us stronger after the surge is going to give us a generation of a stronger continent. And they'll be proud of us when they say, you know, 10 years ago, when you faced that COVID situation, you made this continent stronger. Innovations, technology, and finally, I think it'll build more trust between what the private sector does and what the ministry does. Next. So as I end, I think the call to action is amazing. The communication and the relationship, Dr. Moeti, we've had with you and also with Dr. Tedros from Geneva. We as the leaders of the private health sector in Kenya will continue to play our role. We will continue to raise funds and we'll continue to have as many gainful people employed in our employ. But what we are looking for is guidance from WHO and support from governments and ministries on how to engage private sector. So the 6-pillar system that David brought out is amazing. So I'm looking forward for a Francophone and an Anglophone connection from Congo, Brazzaville that will help us, private sector, communicate all the time. Consistent and frequent exchange of information, both from our side to you and also from your regional offices and head office to us, that we can share effectively to the private sector, be over and above probably the publications. So if there are any special asks, like I've seen this one that you did, we will inform all our countries about that. It would be interesting if we created and signed, like we've done with AU, an institutional partnership and a relationship between WHO Afro and AHF. We know we went through the process on the WHO website about this, but the faster we create this relationship, the more vibrant we can continue working together on mutual areas. And then an agreement on concrete areas to support COVID-19 response through your office with the ministries of health across. So next slide, Serish. If I can share my screen, and I'll just show you 2 or 3 areas that I think are useful as I end. One was, I do want to share with you, as I mentioned, the Africa Public Health Foundation is an example. This was founded last year as a 5013 charity, and I'm delighted to let you know that this is the first foundation founded by Africa, in Africa, especially in a timely fashion to deal with pandemics and emergencies. It's registered in Mauritius, has an operating office in Nairobi, Kenya, and it works very closely with the Africa CDC. The founder is Dr. Bernard Haufiku. Together with counselors, we have a strong, robust system. I'm just showing you one example of an interesting African initiative that has helped us to move forward. I would also like to share with you one more initiative that was the one that Dr. Moeti talked about. And I think these were the 4 envoys who were appointed under the AU. They're doing an amazing job. The private sector is roped in with Afro Champs, and the Africa COVID-19 Response Fund also has many of the Africa Healthcare Federation members who are supporting at the secretariat and at the operational level of this fund. So these 2 are examples, and this might be a good time, Serish, for you to play that 1-minute clip of what the private sector did in Lagos before we open it up to questions. This clip that you will see here is a nice initiative taken on by the private sector in Nigeria in mobilizing their own resources to help patients who are mildly sick or even moderately sick to ensure that they get treatment. I'm not sure if, Serish, you're able to do that. Go ahead. Thank you so much. I'll turn it over back to David. That was just a little bit of what we have been doing as private sector in Africa. I hope that's been useful. Over to David. Thank you.
So thanks very much, Amit. Thanks very much also to Dr. Moeti for her presentation. So now we thought we would have an opportunity for a conversation between the panelists about the various topics and issues that we've been discussing today. And maybe I could start with Dr. Moeti and maybe ask her to reflect on what she thinks about the asks that the private sector have asked of WHO in regard to the COVID-19 situation. So Amit made a number of comments and suggestions that WHO might be able to take up in relation to working with the private sector in relation to COVID-19. What do you think about those suggestions, Dr. Moeti?
Yes, thanks very much. Thanks, Amit. That was really great. Very thoughtful, informative, and with some really good suggestions. I mean, I think that certainly, first of all, getting the private sector involved in the planning, the thinking of the ministry, of the government, let's put it this way, because this is something that goes beyond the Ministry of Health, as we have seen. In most countries, there are high-level task forces, sometimes under the chaired by the Prime Minister, sometimes chaired by the President, that are making most of the policy decisions. And then there's the Ministry of Health and their technical group that are working on the public health aspects. We could facilitate this as WHO. I mean, it's very easy for me to send the word out to my reps and ask them to engage on this and look for ways to encourage and support the ministry to reach out to and work with the private sector. If I just take that example. So that facilitatory role we could play. It requires relationships even at the country level. So it requires that our country reps and their teams be aware of, I hope they are on the whole aware of, and be involved with the private sector groupings that exist. And if not, then find ways to engage with them and advocate for and define ways in which, I mean, based on some of the tools that I was mentioning and the guidance and the plan that you mentioned, David, which we need to become aware of, by the way, in the region. It needs to be known by the country reps, who played a very critical role in supporting the governments to develop their national public health action plans. That now are looking desperately for the resources to make those work. So, I mean, if I just take that example, I think that is something that we can do. We can also, from the regional level, because we speak regularly with ministers of health, engage them at my level and encourage them to do this as a strategy for improving their capacity and ability to work on some of the very things that they were expressing huge concerns about at yesterday's discussion, as I said. So these are some things that we could do. They require sharing of information. So for example, if the governments don't have access to data about the private sector, I would think it would be very important for the private sector entities to find ways of providing this data. For sure, governments have the responsibility of knowing everything that happens in their territories, but we know they don't have a capacity to collect some of this data. So I think meeting them halfway with some of this information would help. Stuff around guidance, tools, that's something that our teams could do. I have to say, and I'm sure you will agree, David, that because the situation is changing so rapidly with this pandemic, WHO is updating guidance virtually daily. And it's sometimes very difficult to keep up with what's being produced. So we would have to work around that. What is some of the most important guidance that private sector partners, for the roles that they are playing, need to be made aware of? I guess people can be encouraged to keep going to the WHO website, but we need to find more user-friendly ways for people to know this is very important, it's just come out. I mean, it implies, to be quite honest, having, for me, it implies having not only a rep, the reps are stretched widely in what they're trying to do, but it requires also having some capacity. Somebody in our team at the country office must be the person who is monitoring, working on this, facilitating this partnership with the private sector. And as you know, certainly in our region, our staff are very much overstretched. But I mean, just to say, this is something that we could do, or these are things, because they're varied, that we could help to do. We would need to develop the capacity to do this, and one needs to be upfront about that in our country teams, and then just recognize that this is a good investment. If we can mobilize some of the funding to make it happen, I think if WHO can play this catalytic role in developing these partnerships, that's something that we could look at investing in together. Okay.
That's great. Thank you, Dr. Moeti. Just to take up a couple of the points that Dr. Moeti mentioned, Amit, one of the issues that she mentioned, which is one that you also mentioned in your presentation, and that's this question of data. What do you think the private sector can do to inform the public sector of its capacities and capabilities? And are there any country experiences from the African region that you can tell us about where data is being collected and shared?
Yeah, that's a good one. One of the reasons private sector was reluctant in data was that they weren't sure what the data was being used for. And sometimes a lot of data is being asked and they spend between $200 to $1,000 on data entry from a certain format. When we started telling private sector this data is not for the revenue authority of your payroll or how many you employ, private sector became a little bit more interested in sharing data. And then we started looking at DHIS2, and the central repository for government under many platforms like DHIS2 is something where we need interoperability, because private sector has spent a lot on their own IT systems. It would be difficult for them to spend again a few more dollars. So I think the trust, David, to your question, is the trust is improving, the data is moving. And for example, Kenya is one such example that we were able to share data in the COVID to just show how many ICU beds we had. Give an example. So we know how many ICU beds we have, what is our current occupancy, how many ventilators are operational, and that data has now started coming in, and the Federation, to its members, plays that role in making sure that it's trustworthy information being shared both ways. So it's one step.
That's great. Thanks, Amit. I'm wondering, just to give, I've just been watching the chat function and we're getting a lot of really great comments and questions. I wonder if it's now timely for us to open up the floor for everybody to have their questions and to have a discussion about the points that we're raising. So I think what Barbara was going to do was to moderate this part of the conversation and to pass the questions on so the panelists could address the specific questions that the participants are asking. So maybe we could now move to that stage. So on the screen we have some questions that have been posed by the people who are participating in the webinar today. And the first one is about public-private coordination. The first question is, public-private coordination are a challenge, especially with this pandemic. How do we address this? What do you think, Dr. Moeti?
Well, yes, I think we've already started talking about some of it.
Yeah.
I guess, you know, if I put myself in the place of a minister of health for a minute, they are having to work with different groups at different levels. First, they're having to deal with the multi-sectoral, high-level, if you like, task forces, decision makers, advisors to the head of state often, where they are seen as a technical partner. Then they're having to work with partners who are supporting them in the traditional way. So WHO helping them to coordinate, other UN agencies, other bilaterals, etc. So what I think would help would be for the private sector to be somewhat organized so that it's easy. So there's an interlocutor representing different interests of the private sector and helping to coordinate them and get them to agree together what are the sort of contributions that they can make to facilitate the dialogue and make it not so costly for the ministers and their teams, and to help for it to be coherent and coordinated. So it's not going all over the place with different people talking to different private sector partners, I would say. And then I think WHO could be asked to play that role, because we're very much used to helping the government to coordinate partners. As I said, we can ask our people to do more than that, to help them recognize this capacity and potential that is there for them to leverage if they turn towards it and they find ways that they feel would be effective, would be safe. I mean, and again, I think it's very much around the issue of trust, previous relationships, previous experiences in working together. I think that could happen. And I guess the document you were talking about must outline some of that, David, otherwise it would be
absolutely. Yeah, absolutely.
Yeah, it would be helpful for us to then help guide our colleagues as well in how to turn to this. Yeah.
Yeah, great. The next question we have is about political will. And it's clear from some of the comments that have been made on the webinar today that there are some countries where there seems to be a reluctance to engage with the private sector at the political level. Amit, what do you think we can do to open up dialogue between the public and the private? Do you think we need better guidance on national policies and information dissemination to speed up this process?
Hmm. I think that when you talk about dialogue and dissemination, let me take that slightly different. The dialogue, I think what Dr. Moeti mentioned is trust. And it really is, you can't build trust because of an incident. It should have been built time. And now because of the pandemic, I think organizing the private sector together in an association like we've tried to do is what I think would be the first step. And the second is that the ministries which are dealing with so many partners, multilateral partners, donor partners, including counties in some cases, need to find also the political will to engage private sector, just philosophically. And then dissemination of information will be much, much easier, saving their citizens much be easier. I think that might be a way forward. Yeah.
That's great. Thank you.
If I can come in just a minute. So, Amit, what would the incentive for an overworked minister pulled all over in every direction to invest some of their time, effort in the private sector?
Yeah, that's true. I mean, one thing is to say, look, if we can make it easier for the minister, that was one focal point, and we can do the communication strategy and dissemination on community preparedness, you know, that is the incentive that we will reduce transmission by X%. We will be able to save deaths by X% should you involve us, and we can play our role. And that could be an incentive. And another incentive is the more you involve us, the more resources and donations will come through. I can tell you there are lots of people in private sector who talk and say, should we give it to the ministry? That they're going to just waste the money. It's going to go down the tube. You know, we know what happens to our dollars. They get lost. But if there is more relationship, then the suspicion of corruption is reduced. So it's a two-way street.
Great. The next question that we have, and I think this is again one for Dr. Moeti, is there's been a lot of information in the last few days, including a statement at the UN about this very important question. In relation to the question of mental health and the COVID situation, what are the private sector, what is WHO doing about supporting and funding for mental health as part of the pandemic?
Yes, hi. We're working with member states on, and this is being led from Geneva, but our colleagues are very much involved on essential services that need to be provided, immunization for children, safe deliveries for women, ongoing treatment for chronic diseases. And mental health is one of these that in fact, I even reminded the ministers about yesterday. I think it's something that we need to continue to emphasize, because in general, I think we all know that mental health is not resourced up there among the priorities in African countries, far from it. I think in those countries, we still see that they have this one big institution where people need to be sent when they are mentally ill. They have not even gone very far. Some countries have relatively few in integrating this into some of primary care because of the resources, especially the clinical resources. So I think it's something that we need to continue to promote. We have to acknowledge it is going to happen in already a background of underinvestment in mental health. We would need to find creative ways to help the governments to do this. And again, you know, not wanting to be negative, I think it's an uphill task because we're starting off in a very under-resourced context, but it is very important. I think what WHO can do though is to find ways to encourage governments, and perhaps here the private sector might play a role. You know, it may be that some of the clinical expertise is available in the private sector that might not be available in the government institutions, and it could be one area which gets emphasized for this partnership.
Do you have a response to that, Amit?
Yeah, I totally agree. I think the expertise lies there. We may not have the volume maybe of the expertise, but I think specialist expertise and coordinated expertise for psychosocial support, I think private sector can come in. I know Red Cross is one example from the private sector side, together with our psychiatrists that have put together a psychosocial support program. Yeah, I think it can there's definitely a role there for PPP.
Right. The next question we have, which is a really important one, is how can the private sector and individual resources assure food security and healthcare for vulnerable populations, migrants and the poor, etc.? Amit, would you like to comment on that?
Hello?
Hello, sorry, Amit, would you like to comment on that question? The question of how the private sector and individual resources can assure food security and healthcare for the vulnerable.
Sure. I think sustainable food security would be a challenge. It's CSR modified currently in COVID-19. Lots of institutions, groups, private sector companies, associates have started giving out food packages. But I think the food distribution and the safety net measures that we need to put through for food security will need to be government-led, whether it is cash transfers so that they can buy food or food packages being distributed to the vulnerable population, must be government-led for sustainability. When it comes to healthcare for the most vulnerable population, I think I would still say that the first choice for that is a free service that is tax funded through the government facilities. And obviously where the private sector will come in are those who are located in IDP or camps, and they may need the highest economic stimulus so as to waive these healthcare bills for treatment of this vulnerable population. That's the way I see it.
Thank you. We also have a question on information and data, which looks at the issue from the other side. Previously, we were talking about how we can get better information from the private sector, but I guess the flip side of that is how can the public sector make sure that it's fully transparent in terms of statistics and information sharing to build the trust that's required that both panelists have mentioned. Dr. Moeti, do you have any comment on how public institutions can be more transparent in relation to its dealings with the private sector and the rest of the health system?
Sorry, this refers to data in general or data around COVID-19?
I think data around COVID-19, but maybe also data in general.
Okay. I think, you know, again, sharing data, trust around data, how data are used by partners, those who receive them, is a big question of trust. I mean, just starting with the more general, we work very hard as WHO to help governments to collect data, to analyze data on different program areas, even on the performance of their health systems, and share it. And this I think is a very ongoing, constant effort to encourage the open sharing of data, but also on the other side to work with the partners to ensure that this data is used and handled, if you like, responsibly. Because quite often when I speak to ministers of health, they're like, well, you share data, then you suddenly see a paper published by somebody. Maybe this is more to do with academics and your data without any discussion. This I hear very often. So I think, again, it's really a matter of building the trust on what the data will be used for. As you know, at the global level at the moment, there's a lot of discussion around some of the technologies that can be deployed to support what's going on, people's movement, are they contacts, were they in the vicinity of a case, and privacy issues and concerns about how this data will be used by the private sector companies that manage the platform and the tools, apps that are going to be used. So I think it's an ongoing issue. There is a challenge with sharing of COVID-19 data. You know, it reminds me very much of the days when I was a national program manager for HIV in my country. And the data of people infected used to be locked in a desk in a drawer in my desk. So myself and the person on the lab were the only two people who had this data. Well, because I mean, before it got stripped of identifiers of the people concerned. So there's a certain amount of stigmatization of COVID-19, which frankly has surprised me, because I've worked in a program of a sexually transmitted infection. So I just thought, well, you know, you get this by breathing. So why is there a stigma? Perhaps it's because it's been promoted so strongly as being so fatal and all of this. It drives some of the issues around data. So we are working on it. I mean, let me just acknowledge this is a challenge, and we are working to persuade the governments to be more open, to be more timely with sharing the data as well, and to understand this is a globally shared issue. So, you know, if the Prime Minister of the UK can talk to people gasping from his hospital bed, perhaps we can also understand that it's helpful or not. So I think we all need to work around communication on this illness and diffuse some of the fear and stigmatizations, then perhaps it might be more open.
Thank you. Amit, there's the question here which goes to one of the points that you made in your presentation, and that's the question of funding. The person asking the question makes that point that most of the funding that's coming in for the COVID response is going to governments. What support do you think, what support do you see being provided to private sector organisations at the moment? Is there support being provided? And if it isn't, what sort of support do you think that the private sector needs?
It's such a good question. I would say that the first 4 to 6 weeks of the outbreak in Africa, every private sector organization in Africa was hoping it would be part of the national kitty. 95% of the national kit in Africa is enveloped for the public health system.
Right.
So we are in a situation right now of a disaster at the private health sector. It's a large private health sector disaster compared to any other pandemic emergency, because the amount of funds going to government, even from the private sector, is being enveloped for the public health system. So when Dr. Moeti showed 30% is being provided by the private health system, it's a looming disaster. So we have started thinking of a private sector resource center for Africa, where private sector will help private sector, because it's an unusual situation. It's an unusual situation because this is not a profitable disease. Neither will it bring any revenue, but it will knock out, as I mentioned, many of the small and medium-sized clinics. So it's a tricky question. I am not able to organize. I think the development partners and all the other foundations and philanthropists need to treat private sector differently, because there is no self-sufficiency in this pandemic. That's what I can answer.
Can I just follow up on that? What do you think will be the consequences of not responding to that challenge post the pandemic?
So the larger private sector will probably survive and then dominate the private health sector delivery system. The smaller ones will be knocked off and will take probably 5 to 7 years to rebuild, if at all. You might find some of them now moving away from healthcare and going into other kinds of potential businesses if we don't bring them up. This might reduce access to healthcare.
Right. Okay, that's a great point. I think we just got time for one more question, so I might ask that to Dr. Moeti. And I think just to think in the longer term, we've been talking a lot about, and you actually mentioned this in your opening, there's a lot of really interesting things that we could be doing with public-private collaboration as part of the COVID response. How can we ensure that any innovations that occur or any fruitful partnerships that are set up are retained and elaborated and moved forward in the longer term post the COVID situation. What do you think about that, Dr. Moeti?
Yes, thanks. I mean, I think there's multiple ways in which we could collectively work on this. I mean, so speaking from our work in WHO around universal health coverage, outbreak preparedness and response, I think we need to work into our own guidelines, the role of the private sector, because in a way, our mindset is very much geared towards the public sector. When we think about a health system, we think first public and then, in addition, private. So I guess as a very influential organization in framing some of this for countries, we need to make that shift in WHO ourselves, I do believe. And that was part of what we were doing in seeking, as I explained, to understand through our Harmonization for Health in Africa platform. So what is the private sector offering? What are they thinking? How are they going to be working? It was very much with the idea of then being more, if you like, mainstreaming this huge resource into our own thinking and in the guidance that we provide. And I think we need to send that signal all the way up our organization to those people who do normative work, because the normative work isn't just saying this is a patient with pneumonia, it's also around this is how you structure and organize a health system and be aware of the role that we can play in influencing decision making. And then I think it needs to be done also at different levels. What we need to influence, I mean, I was just thinking as you were talking about the financing mainly going to the public sector. The donors also need to understand, because donors are important in African countries and they will continue to be for some time to come. So some of their mindset has to shift. I also think we can find some champions among public sector leaders and health ministers, for example. Those who've had a really good partnership with the private sector. We need to work with them to amplify information sharing, their sharing with their counterparts, their colleagues, so that we, in a way, we need to start a little movement of private sector partnership champions among the public sector leaders, the ministers of health, because they can influence each other a lot. I think they exchange as peers. So this is some of what we need to do. I think I'm sure there's lots of scope at different levels to support this.
I think that was an excellent summation. Thank you. Thanks, Dr. Moeti. Amit, do you want to make any closing comments from your perspective?
I think in every crisis, there's an opportunity. Most of you have heard that. And this, I would consider us as all the friends of Africa to use this as an opportunity to create a system to improve the life expectancy and the livelihood. Let's work together. I really like the points that came out from WHO and the champions. I like the points about working with the ministries of health. And I'm really grateful for the work that private sector has already done. I think together we can make the continent stronger. We have a rough time, but I think we can use it as an opportunity. Thank you.
Well, I've really enjoyed the conversation today. It's been really fascinating. And I've really enjoyed the opportunity to talk with two esteemed public health experts on the situation in Africa. I'd also like to thank the participants for their thoughtful questions. I'm really sorry that we didn't get to answer all of your questions because of the time constraints today, but I'm sure that we can provide written answers to the questions of those participants who haven't had their question answered. So I'd just like to thank everybody, thank the panelists for their time and for making such great contributions. I'd like to thank the people who ran the webinar for us today, and I'd like to thank all of you for participating. Thank you very much.
Thank you, David. Thank you, everyone.
Okay, thank you, Amit, David, everybody.
Thank you,
Thanks
Moeti.
for great questions.
We will be in contact. Take
Sure.
care. Yes.
Okay,
Right.
take care, everybody. Okay, thank you.
Bye.